The Colonial Pipeline has returned to normal operations, but gas shortages are likely to persist throughout the southeast for several more days. Gas Buddy reports 3/4 of all Washington, D.C. gas stations are out of gas. That number is 48% in Georgia. Alabama is sitting at 9%. That means about 1 in 10 stations are out of gasoline, and that number hasn't moved in nearly 24 hours. Tonight, emergency medical services are navigating the gas shortage with careful planning. It's to make sure they can do their jobs. Wave 31 Sierra Phillips met with the director of Marshall Medical Center's ambulance service. He explained they have a contingency plan in place and say that they will stay fueled up.
So far, we've been pretty lucky with no big problems.
So far, Marshall Medical Centers has managed to keep their ambulances fueled up and ready to save lives. If the shortage did get more serious, they've got a plan.
With the county government, they have supply that would not be available to the public that we could tap into and utilize if we needed to, and then maybe even follow up with National Guard to provide resources if needed through the state.
They'd also save their gas for emergency calls instead of routine transports. So far, these steps haven't been needed, but Parker says a concern is panic buying.
It takes away from the availability for all the emergency services, so that is something that we wish everybody would keep in mind.
Area gas stations have also stepped up, reserving a lane for emergency workers to avoid long lines when they need to.
And the healthcare system overall, they have contingency plans for just about any kind of issue that comes up.
I asked Parker if they would do anything different next time if this does happen again. He said no, they were prepared and ready to go when this happened. Reporting in Gunnersville, Sierra Phillips, Wave 31 News.